The only thing that I really could remember from both of those was that, get my affairs in order. Things aren't good. 6 months to a year and a half at best with treatment. The symptoms that I had, I didn't know was lung cancer. One of the first symptoms I had was immense fatigue. And I have a brother who has multiple medical issues, and I'm a registered nurse. And the year prior, he had a very simple procedure done, but unfortunately, he had a lot of respiratory complications. So he ultimately ended up with a tracheostomy and a feeding tube. So my family lives a little over 2 hours away from me. So he ended up in the beginning being in a nursing home, and he was in and out of the hospital quite a bit. And I was still working full time. So the fatigue at first really didn't startle me because I was constantly running, taking care of him. My parents were living with me, working a full time job. The fact that the fatigue, I had lost a lot of weight while not trying to. I lost over 70 pounds. Again, didn't think about that, being a cause of lung cancer. So I was getting ready for work, and I started to get a twitch in my eye and in my arm. I originally was going to take myself to the ER, but I can feel that I was going to lose consciousness. So I was able to call 911, unlock my door, grab my migraine medication, and put it in my purse because I knew the paramedics would search. And I called my boss to say that I really wasn't feeling well, and I think I'm going to lay down for a little bit. I thought I was having a stroke. In reality, I was having a seizure from the mass that was in my brain. I was terrified. I knew I was going to lose consciousness, and I really wasn't sure what was going to happen after that. When they brought me right to the CAT scan machine, they immediately found the 2 centimeter mass in my brain and all of the edema that was around that. And they continued to scan from there. There was a 3 centimeter mass in my lung. All my mediastinum lymph nodes were all enlarged, and they found multiple other, we'll call them spots, both breast, ovaries, liver. I remember nothing because I was unresponsive. They had given me Ativan for the seizure. Very typical. After they had given me that, I was no longer able to protect my airway. So they had to intubate me. And I was in and out of it that whole day. I told them they were wrong. I said, there's no way. I said, I'm 36 and I'm healthy. The week before that everything had happened, I kind of thought I had cancer, but I thought I had lymphoma. That's a cancer that runs in my family as well. When I was in nursing school, during my oncology rotation, that was not what I was taught caused lung cancer. And young, healthy women didn't get lung cancer. Young, healthy men did not get lung cancer. I am the picture of lung cancer. There's an increase in young, healthy women. The oncologist that I was assigned to, he would spend 20 minutes, 30 minutes by my bedside, trying to hold my hand and, giving me these grim statistics, and I wasn't going to make it, and to get my affairs in order. So finally, and now I'm alert at this point, I finally have had enough of this. And I told him to get out of my room. Part of it is my nursing background, I would definitely say. And I'm, a strong, independent woman as well. And I didn't settle with my brother either when things weren't good. I always pushed the envelope and always advocated for him. So he came back and he had referred me to an NCI center that was about 2 hours away from me, and best thing that he ever did for me, because if it wasn't for them, I wouldn't be here today. The thoracic oncologist, who's my thoracic oncologist still, could not believe that I'm walking around with this mass in my brain in 2 different hospitals and about 3 weeks at this point, and no one has taken it out. So he immediately called over to their sister hospital where neurosurgery is and went right away. I was taken over to the hospital, met with my neurosurgeon, and he explained tumor board to me. So tumor board, the best way I can explain it is it's all these smart people in one room or on a Zoom screen, and they're talking about the patient. No names, no identifiers, and they're talking about the case and what everybody thinks is in that patient's best interest as far as surgery, radiation, any treatment plan. I went back to his office that Thursday, and I had a craniotomy the following morning. I was definitely scared because of, with I make all my brother's medical decisions. However, my mantra was I wasn't going down without a fight. And I had relayed that to my team. I said, we're going to do everything we can. And that the one thing that everybody kept saying, even at the prior hospitals that had given me the death sentence, she's young and healthy. That was one of the things that they kept stressing. And I knew nothing about biomarkers. So in the second hospital, they had sent me up for a bronchoscopy. And this is one of the things that I am passionate about: biomarker testing. No one explained to me that they're going to test my tumor for this when they did the bronchoscopy. Everybody was just kept saying, get your affairs in order, get your affairs in order. No one was giving me hope until I landed at the NCI. I didn't believe it when they said you're going to take a pill, and I said, not for stage 4 lung cancer, not when I went to school. I had already had myself that I was going to have a port. I even picked out a tattoo that I wanted to go over where the port was going to be. So yeah, I was really surprised that there's this now precision medicine for lung cancer that you can take a pill. That was never the case. I'll be honest with you, I was kind of like, okay, if you say so, but I really wasn't buying into it. And then when my first scans, I did have a partial response to it. So I thought, well, all right, this is working, but of course, I didn't want to have any cancer left in my body, which was not the case. But yeah, I was definitely skeptical at first. So after I had the craniotomy, about a month later, had what they call CyberKnife therapy to the brain cavity. It's in the form of radiation, and it's not like what they say whole brain radiation is. It just targets the area where the tumor was. And then after that, I was able to start Tarceva, which was my first line targeted therapy. And again, I really didn't have any symptoms when I had my progression. I had started on my next line treatment. They found the resistance, T790M resistance, which normally does develop with Tarceva, and I started Tagrisso. It's surreal still, knowing that I can take a pill every day. It doesn't interfere with travel plans. Really, it doesn't interfere with anything. I take my medicine at the same time every day, and I just take my pill and nobody knows. When I tell people, and I was just at an event this past Monday, somebody had asked, well, how did you get connected? And I said, I'm a survivor. And they just looked at me and they said, how old are you? I said, I'm 45 now. I said, but I was 36. And they couldn't get over it. And again, that's the thing, we don't necessarily always look sick, but something to remember is that we do have side effects and we're not the same that we were prior. But yeah, it's, unless you knew, you don't know that I'm walking around with stage 4 lung cancer. And to say that I'm 5 years, no evidence of disease this coming July, I don't think I've really processed it. I'm still a little in shock. And, the fact that coming into 9 years since my original diagnosis, I was still worried that I was even going to see a year, because when I had my progression, it was coming up to that year and a half that the original 2 hospitals had given me. So I was always somebody that was constantly on the go, didn't stop, didn't enjoy things. The morning was, okay, have my coffee, get ready for work, get my shower, and just keep going, going, going. And I've learned that that's not the way I want to do life anymore. I really do. When friends come to visit or when I go someplace, I like to sit and relax. I like to make a plan, during the day of I'm going to have some time for myself just to decompress where I never ever did that before. I'm pretty proud of myself because this isn't easy to go through. And I'm not going to lie, there are still days that, got to pull the blankets over my head because I can't deal or handle it, or however you want to say, or it gets heavy at times. Lost a lot of friends within the community, but I always get back up the next day and, back at it. And it's okay. Sometimes you need to do that and sit with your emotions and take that time for yourself. Don't be afraid to get another opinion. If you have any member of your team that says, no, don't get an opinion, what we're saying, that's not who you want on your team. My doctors have always been great about that. I hear other providers, and when I'm at conferences, is it an exciting time to be in lung cancer? Not really what we want to hear, or how you want to, put it in perspective, but it is. I mean, they're absolutely right. Just in almost 9 years, what I've seen, and friends that are further along in this journey, what they've been able to share, it's amazing. And what's to come. Find your people. There is community out there. It's amazing how far the lung cancer community has come. Everybody, some people don't get involved in advocacy at all, and that's completely okay. You do what makes you feel comfortable. We're all different, but there is community out there compared to what there used to be.